Hello, my name is Dr. Uday from Arogya Physiotherapy, and for today's video we'll be talking about spondylolisthesis. By the end of this video you will know what is it, how it is caused, what it can result in, and how it is treated. I will also be mentioning some lifestyle modification things that you have to do so that you don't aggravate the pain. Okay, so let's get right into it. So spondylolisthesis is just the slippage of the vertebra, one vertebra on the other one. So we have multiple vertebrae in the spine that you know. So what happens is, due to multiple factors which I will get into later, one spine slides over the other, or that stability that was there before is weakened, so it just comes in front. Okay? This can result in multiple things. First we'll see why it is caused. It can be caused if you already have let's say, the genetic abnormality in the spine. It can happen due to that. It can also happen due to a stress fracture. For people who regularly jump now, like for example volleyball players or basketball players, stress is transmitted through their spine repetitively, multiple times. That eventually causes fracture of a small part of the vertebra called pars interarticularis. When that happens, it happens at one side. When that happens, that is when this condition starts. Okay, if you don't take care of it, then both sides are affected, and it is even pushed more forwards. So if this is a normal spine, the pars interarticularis keeps it locked in the same position. When that is broken, when that is fractured, it slowly moves forward. Okay, so what does this result in? It can cause low back pain, it can cause weakness in your lower limb muscles, it can cause sciatica if the vertebra that is down, right? It is impinging on the other one. Are there any nearby nerves? It can cause that. And since, see, I just explained this. So between the vertebra, there's a small canal that passes through it, through which the spinal cord passes through. So when this happens, when this slips forward, that canal is let's say impinged, so that canal is shortened, it's reduced. The volume, the space for the spinal cord to pass through is reduced. That can cause impingement in the spinal cord, and then that has different symptoms associated with that. So these are the symptoms for spondylolisthesis. Now let's get around to treatment. So treatment is generally, we would focus more on your strengthening. So it would be your core strengthening, it would be your posture correction, stuff like that. So it would typically be a program for, let's say, 1.5 months of exercise. And when that is not helping you at all, let's say 2 months of exercise and that is not helping you at all, with NSAI, with anti-inflammatory drugs, that is not helping, then you could look at surgery. But then surgery is still a little complicated. It depends on your particular situation. So if you're very young, you can get a surgery, but you have to be careful. Sometimes when you get surgery at one level, the level on top of that can also get affected. In the sense, there is more erosion that happens at that level. So you have to keep multiple factors in line. You can consult your doctor, your ortho surgeon, neurosurgeon, orthosurgeons who are dealing with this case with you, for more information regarding this. So that is treatment. Regarding lifestyle modifications. So lifestyle modifications will be stuff that you need to do so that the pain is not aggravated more than it already is, and we can actually relieve it. So the first thing that I will be telling you, advising you on, is sleep. So in case you have trouble sleeping, first of all, try not to sleep on your stomach. Okay, that will make the situation worse. If you want to sleep on your back, and if you're unable to sleep because of the pain and that soreness and all, just buy a heat pad and keep it under your back. That will help you sleep. Also, try not to use a soft mattress. Firm mattresses are the way to go. That should help you in this scenario. Make sure you're doing exercises regularly, every day. Make it a part of your life. It is a part of you now. You have to exercise every day. There is no other way around it. And then make sure you're drinking well. Hydration is very important. Your disc is in large part made of water. If you don't have water, the disc will not be healthy. Okay, keep that in mind. Stretches, there are some stretches that you can do that can help you relieve the pain, relieve your particular stiffness and pain and all. Try not to do them immediately after waking up, let's say 1 or 2 hours after waking up. Do them a little bit later. Okay. So what are the stretches? These will be your typical figure of 4 stretches, the child's pose stretches. We will show you a demonstration of these particular exercises later on in the video, but just keep these in mind. Stretches you can do, they will help you relieve the pain. Okay. And one more thing that I wanted to talk about was spondylolisthesis in many cases will resolve and the pain will get better. You can go back to your normal functional activity. But in some cases, there are certain things that you will have to avoid. Some things that you will have to stop doing. Like if you are an avid volleyball player or a basketball player, stuff like that, that resulted in the stress fracture in the first place, you will have to stop playing them. And that will be very hard. Because for many people, stuff like that is now part of their identity. They're like, yes, I'm a volleyball player, that is who I am. So what I would encourage is go see psychologists to make sure to so that you understand that you are not those sports. Okay, you're basically, what you're trying to do through those sports is let out that energy. That is it. What you're able to do in volleyball, you will be able to do in swimming also, or in yoga, or in Pilates, which helps me move to the topic of Pilates. Mat Pilates is especially helpful for spondylolisthesis and yoga. So incorporate those things into your life, and that will help you maintain or even better your situation. One more thing that you need to keep in mind is, let's say if you have spondylolisthesis and you have to travel for long distances, let's say you have to go on to an international flight from India or anywhere that you are to another place far off. It will take you 8 hours or 9 hours and you will not be able to move. So what you're gonna do is, if you're scared with the pain, what if the pain aggravates and I'm not able to, my entire trip will be cancelled, my entire mood will go. What you can do is, you can invest in a TENS machine. These are available readily online. TENS machine will help you relieve the pain while you're sitting for prolonged time. Just buy it, apply it to the same places where the pain is, you will feel relief. This is just a temporary measure, it is not a cure. I am repeating, it is not a cure, it is a temporary measure to help you pass through that long period of sitting. Okay. Yeah, and also if you're not just traveling, if you're just sitting at office, you have to sit for long hours. What you do is keep a timer on your phone, 30 minutes. Every 30 minutes, get up, do some stretches, move around, walk around, drink some water, come back and sit. Again, if you have seen our last video on low back pain about lumbar disc prolapse, there I have given some tips regarding what to do and what not to do. Similar tips apply to here also. So if you every 30 minutes, get up, do the stretch, drink water, make sure you are having a lumbar support behind your spine so that you're not putting too much undue pressure on it. Keep an eye on your posture, keep your core braced, activate your pelvic floor muscles so that your posture is perfect. That will be it for the lifestyle modifications. For the exercises, we'll just see now. For the exercises, there is a branch of exercise called Williams flexion exercise. So the first one for that will be a single knee to chest, lie on your back with your knees bent. Hold it with both hands on your chest, hold 15 seconds to 30 seconds and then switch your hands. This will be the first exercise. Hold it for 15 to 30 seconds. For the next exercise, it will be both legs at the same time, double knee to chest, similar to the last one, but hold it for 15 to 30 seconds. The next exercise will be child's pose. So this is a fairly common exercise in yoga. Come onto your in quadruped position and lean back. This will feel a nice good stretch in your low back. Perform this also for 15 seconds. Next will be figure of 4. This will help you stretch your hip muscles, help elevate any sciatica that you're feeling. Do it in this position, hold it for 15 seconds. You're supposed to stretch daily and you're going to strengthen every alternate day. So what are the exercises that you will be doing is, first will be pelvic tilt. You can bend both of your knees together and then press your back onto the mat. This will help you tilt your pelvis up and down. Hold for 5 seconds and relax. Actually our end goal is you will be able to hold for 6 seconds for 15 reps. That is the end goal. That will be pelvic tilt. Once you can do this, once you can hold for 6 seconds for 15 reps, we will go on to partial sit-up. Legs, knees bent, hands to your side. You're going to activate your core, you're going to press your back to the mat, and while using your core, you are going to lift your upper body up. Breathe out while you're doing this and come down. This is an advancement to the pelvic tilt. Only and only when you are good at the pelvic tilt part can you go on to this. Next exercise will be squatting. Stand with your feet shoulder width apart and then lower down as if you are going to sit on a chair. Keeping weight on your heels and knees behind the toes only. Only perform this in the range of motion where you don't feel the pain. Slowly progress as you go and keep doing this exercise daily. We hope that the information provided in this video was helpful to you. If you have any doubts, any concerns regarding the exercises or any information provided here, just hit us up on the comments and we'll reply to whatever questions you have. Make sure you're doing the exercises daily, and regarding surgery, please contact your orthosurgeon, neurosurgeon. So if you like this video, please give us a like, subscribe to our channel so that we can provide more helpful videos like this to you every day. So witness your fitness with us.